Well, here is the consultant, the fish doctor, Gerald again. I try to do precision guesswork based on unreliable data provided by those of questionable knowledge. See also wizard magician. Yes, I can be a consultant because sometimes people do not use a microscope, and I can. And I'm able to help you out, like with this case of a dwarf, small puffer, that was suffering, and a microscope explained me that, well, something was going on that fish that would be worth examining and how we can cure the fish. That is only possible when you know what disease is causing the fish to die or to suffer from. And here it's the Carinotetraodon pufferfish with parasites, the Tetrahymena infection. I explain details on fish diseases in my books. Please try to get my books in. They are available in different languages. We have the very big book with 1,000 photographs that helps you to become a more advanced fish keeper. Here we see that puffer fish. Well, you can see some patches on the fish, some skin lesions. The fish were wasting away. Here, there's also one here in the back, and they're getting skinny. They were not eating properly after a while. So nothing obvious, clear as a sign. We could determine, well, it's white spot or it's this disease. Well, that's why we have to examine. And we took a skin scraping, and you could see already some parasites, Tetrahymena, on the skin of the fish. Here you see them. Those parasites, well, they can be nasty. They make little holes in the fish. They make lesions. They make wounds, sometimes reddish wounds. And that's very bad for the fish. Here we also found those parasites, Tetrahymena, in the gills. You can see the gill reaction already excreting slime as a reaction against the parasites that are, well, eating on the gill tissue, because that's what the parasites are looking for. Here we can see how those Tetrahymena uh, parasites are damaging the gill tissue, the lamellae. Well, this is of course very bad for the fish. Think about it when you have those kind of bugs in your lungs and eating away your healthy tissue. And even worse in this case was that we found Tetrahymena internal in the abdominal cavity around the organs. So somewhere the parasites were really in such an advanced stage infecting the fish that they came inside the tissue of the fish, inside the organs, next to the intestine. Here we see in the abdominal cavity, here the mesenteria. And of course, this fish cannot be cured, because how are you going to get the medicine inside that fish to get it, those parasites away, particularly the medications that is needed to kill these parasites? Well, the origin of this infection is poor handling, is stress, is overcrowding, is dirty water, many factors that the fish became in such a bad shape. Somewhere during the trading process, something went really wrong. For some fish, it's too late to cure, like here in this case, when the Tetrahymena are inside the abdominal cavity and infecting the organs. Forget it. No way you have to put that fish gently asleep. Normally, treatments with FMC have been successful. FMC, I explain the dosage and treatment in my books. It's formalin, malachite green, and methylene blue, a combination of these three that helps against those external infections. But it only works when you administer this medication within time, on time, not too late. Too late, the disease is too advanced. You can not help it. At the same time, you can help this specific fish with our Dr. Bassleer Biofish Food Cavar that helps the immune system of the fish, repairs the fish where it's needed. Well, more details on fish diseases in my books, and about treatments in my books in different languages. Or you can get a training at my Patreon, where I can teach you how to prevent diseases, what are the causes, and how to become a good fish doctor. Well, I hope that I help you to understand that this infection can only be found and diagnosed with a microscope, and that Tetrahymena was already advanced. So the origin was somewhere at the pet shop, the importer or the exporter, or even the collector of the fish. Thank you for watching.